Today's guest is an exercise physiologist, exercise scientist, sports scientist, level 2 strength and conditioning coach who specializes in complex pain, orthostatic hypertension conditions, and she has a range of experiences working in high performance sports. She joins us from Melbourne. Please welcome Emily Bland.
You want first place, come play with me. You want second place, go somewhere else.
It was better than later.
It was an everyday process.
Coffee's for closers only.
You're listening to the Morey Health Podcast.
Hi, Rob. Thank you so much for having me. Really looking forward to having a chat today.
How you doing? Yeah, good. Well, hopefully we get time and we don't have to cut it short from, all of a sudden a last minute patient walks in the door and we can actually have a long one. But no, thank you so much for taking the time to actually sit down with me and have this conversation. So first of all, how you going down there? How's everything? I know it's all been a bit crazy. Has it just yesterday that you guys are now allowed to go more than 5 kilometers out of your house?
Yeah, it was just yesterday and I've got Mondays off. So the first thing I did was head up to the Dandenong Ranges and went for a bit of a walk up in the fresh air. And it was really amazing. And I think a lot of us are needing that at the moment because it has been really stressful and there's a lot going on obviously down here. So yeah.
Were you fortunate enough to live close enough to work to still go in?
Yeah, I've been really lucky, so I'm still coming into work, but everything that we're doing at the moment is via telehealth, although that's about to change. So I've been able to come into work and use the clinic and still have routines. So that's been really, really nice.
Yeah. And then I guess, how has that shaped your practice at the moment in terms of what you used to do back in February compared to what you've been doing ever since?
So we're really fortunate here at the clinic because we work with a lot of people who have quite low capacities or they might struggle to get to the clinic for their appointments. So we were actually already set up with telehealth before all of this started. So it just meant that rather than having 5 or 10% of people that we treated online, we transitioned across to 95 to 100%.
And, that's not necessarily just good planning, it's good fortune and opportunity, but really the benefit there is for the patients that you guys are treating in that they actually get the benefit of still getting ongoing therapy. So if you just wanted to enlighten people where you're working and sort of what you're up to at the moment.
Yeah. So like Rob mentioned, working as an exercise physiologist at Active Health Clinic in Blackburn in Melbourne. And we specialise in education and exercise delivery for people with orthostatic intolerance like POTS and chronic fatigue syndrome, pain disorders, things like that. So like you said, Rob, it's really amazing that we do have this service, this telehealth that we can provide people with, because I've heard some really interesting stories from people who have found it really challenging to get healthcare when they need it the most, when they're housebound and they can't get out.
Yeah. And how have you guys navigated, I guess, older generations that aren't necessarily so tech savvy? How have you got around that?
Yeah, that's a really good question. So from my personal experience, I've been really lucky, and a lot of the people who are more mature, they've still been able to use technology, or they've had a family member that can help them. But that is also where we do still provide in-clinic appointments, and I've done some home visits as well for people who need that.
Yeah, within 5Ks of home. So
yeah, at the moment, yes. But prior to that, we would go a little bit further. So
yeah. And now it's 25, so we're good. We can cover a big area. That's awesome. So if we could take you back to, I guess, where it all started for you. When you were younger, you were a young basketball player.
Yeah, that's right.
If we take you back to that moment, can you sort of take us from then to now and sort of how you got to where you are?
Yeah, so it's a really interesting story and it almost feels like another life, the start of all that. But keen basketballer from about 8 years old. I wasn't very good at it to start with, but with most things, a bit of practice and I came good eventually. And because I was so interested in basketball and in sport, that's all I wanted to do. Was I wanted to play basketball. I wanted to know how I could be the best athlete that I could possibly be. So I took my studies down that route. But interestingly enough, when I started to study in the sport and exercise field, I actually ended up becoming quite unwell with an infection, and then developed POTS and chronic fatigue from that infection. And it was a little bit challenging at first, or as a lot of people with these illnesses would know, it's pretty challenging. But I learned more about it, and I myself was actually referred to see an exercise physiologist after I'd seen a ton of specialists for these health conditions. And that's when I learned about what an exercise physiologist did. And I realized that having studied in sport and exercise, that I was on track to be able to specialize and do my master's in physiology. So I decided that that was very much what I wanted to do. Like, I wanted to specialize so that I could treat people with these invisible health conditions, because not only did I have the education and the background for that, but I had the lived life experience too. And in between all of that, when I was studying sport and exercise and going on to specialise, I worked in the AFL for about 5 years too, with the umpires as head of strength and conditioning there, and then on to the Essendon Football Club, where I spent a couple of years as the high performance manager for the new women's department there, and did some strength and conditioning with the men's teams as well. So it was quite a bit.
You've got a bit of a range,
Yeah.
going from some very specialist type work to some high performance sports work. That's not necessarily goes hand in hand. But when you sort of talk through it, it makes a lot of sense. For those that I guess aren't aware of what is POTS and sort of the associated conditions, can you sort of unpack what it is and
Yeah.
sort of how it works and how it might affect someone? And
Yeah.
then what you might be doing in clinic to help them on their way.
Yeah, so POTS comes under an umbrella term that we use called dysautonomia. And it basically means that our automatic nervous system doesn't work properly for some reason or another. And the reason that that's so broad is because there's quite a few conditions that fall under that umbrella term. And depending on what you're diagnosed with, will influence how your body responds and why it's not working properly. And even for some of those conditions, they're still not entirely sure why the nervous system doesn't work properly. But with POTS in general, that is a postural thing, as the name suggests, so postural orthostatic tachycardia syndrome, which basically means we don't like standing up, and if we stand up for too long, our heart rate increases. And that's a really, really basic overview of it. And I think if anyone who has POTS heard me say that, they'd be like, no, there's so much more to it, because there is. We have so many different symptoms that arise from it, and it's really, really interesting to live with and to treat on a daily basis. But at the clinic, we know that these conditions, so blood pressure based as well, I didn't mention that, and it's about that our blood pressure doesn't regulate as well as it should when we stand up, and then we get all those symptoms that I was talking about. So at the clinic, the idea is that we really educate people on the triggers for their symptoms and how they can manage those so that they can reduce or minimize the symptoms. It's a long process and it's a lot of hard work. We act more as a resource for our patients because we can give them as much information as we can, but they're the ones who take it away and they do the amazing work with it to help themselves. So education is important, but exercise is really important too. So we educate on exercise, and we also prescribe so that people can get a really tailored approach to their exercise, because just because someone is diagnosed with POTS doesn't mean that they're going to be the same as somebody else diagnosed with POTS. Everyone is very, very different from what we see. So that tailored approach is really important.
Yeah, and just sort of, I guess, to expand on that a little bit in terms of individualizing a program and how important a supervised program is. And
Yeah.
when I say supervised, I don't just mean there's some one gym person in the middle of the floor checking their phone. You've actually got, one-on-one or two-to-one service with a health professional who has put that program together specifically for you, and they're monitoring you rather closely.
Exactly right. And I think it's wonderful that we can give those people that one-to-one care. And then we also have options. So it was just over a year ago, I developed something we called the Everyday Performance Program. And it was a bit of a take off the fact that I'd worked in high performance for so long, and that we were using exercise to get these AFL athletes to the top of their game. But when I designed this program in the clinic, I'm like, this is for everyday performance. This is to help people, do their ADLs, their activities of daily living. So it's something every day. And that's a small group exercise program that we run, where people have their tailored programs to bring to class, but they do them with other people with similar health conditions. And it's wonderful from the fact that they have regular check-ins with myself so that we can stay on top of everything. But from the social side, for mental health, it's wonderful to meet people with these health conditions, and they understand what we're going through. So,
especially in these times.
definitely.
And for you guys down where you are, we're
Yeah.
feeling for you. Like the rest of Australia and the rest of, I guess, the world is hurting at the moment. But you guys specifically are close to our heart, considering, you're just south of the border. And
Yeah.
our hearts go out to you guys. Do you mind talking a little bit about what you were doing with the officiating group? Because
Yeah.
I don't know how much you know about my background, but I've been refereeing rugby league for this is my 11th year right now, and that's my latest jersey from my local district area actually. And some of the training that we do is pretty intense, pretty specific, but from a rugby league referee to a AFL umpire, we are under the assumption that we are essentially a middle distance AFL player, sorry, like a midfielder type setup, and they're sort of these ridiculous long distance runners that just run for days. So what were the considerations that went into your training programs for the referees, and I guess some of the testing that you were doing with them, and how you were structuring their program?
Yeah, so great question, because it's a really interesting one. Because when you talk about sport, people are so quick to jump in and think about the actual footballers themselves. And it's interesting to have seen other people work with umpires, and they take that approach where they treat them like a footballer, but it's very, very different from what the footballers need to do. Because the footballers, they need to tackle, they need to be really physical, but an umpire needs to be able to run, and they need to be switched on so that they can make decisions not only under pressure, but under fatigue as well. So looking back at my time, and I loved working there, Rob, it was one of my favorite sporting jobs that I've been in. Such a wonderful bunch of people to have worked with. But we would analyse data. So I think field umpires were running somewhere around 12 kilometres a game, and your boundaries were looking at about 16 kilometres a game. So we really needed to take that into consideration when we were designing their on-field running. And very much so, and I'm sure it would be similar with what you've experienced, but the game is very stop-start. So we need to be looking at how can we make the training as specific as possible. And that would involve, their interval trainings, some fartlek training in there as well. And really interestingly enough, this is something that I worked with the coaches around, but we would make sure that they had some way to make decisions. So it might be change of direction that they need to respond quickly to us telling them where to go. Or it could be that we would have the coaches out there with iPads, and they would run, they'd sprint, and then they'd stop, and then they'd have to watch a play on the iPads and then say how they're going to respond to it. So that was really interesting from an on-field perspective. And I learned a lot in that role, which is for sure. And from a gym perspective, it was very prehab based. And I know a lot of sports are heading in that direction if they're not already established there. But making sure that we were looking after them so that they weren't developing these soft tissue injuries. Because unlike with AFL footballers, who their career might have a lifespan of a few years, or, they're done by the time they're 30, these AFL umpires, we were seeing them umpire up to 47, 48 years old. So it was a big range there that we needed to consider when it came to training.
Yeah, we're in the same boat. We've got people like Gavin Badger, who's just retired, who's 47, and he was the fittest in the squad for years.
Yeah.
Just a phenomenal athlete, and he's the oldest guy there, and it was just amazing. I guess in rugby league that came about after Billy Harrigan started refereeing. He made a point of fitness being the main priority in terms of where you base your training off, and then obviously you build in your knowledge of the laws and decision making skills around that. But he said, if we're going to be professionals at the highest level, we need to act like it, and
Yeah.
we need to train like it too.
Yeah.
So I think that's now disseminated across not just rugby league, but obviously down to many other sports, including AFL. And I just feel like you guys have taken it to a different level. I mean, a lot of our training is like what you're talking about in terms of prehab. I think everyone's training now incorporates some form of Nordics and
Yeah.
Copenhagen's. Like it just seems to be a no-brainer. Like if you're not doing it, something's wrong with your programming. Like,
Yeah.
have you really thought through any of that stuff? We do a lot of decision making under fatigue as well. We'll do sprints for an extended period of time and then come off and maybe not necessarily just even watch footage of a game, but we could even do things like memory games, matching games, pairing games, identification things where you're trying to spot different shapes and colors out of a group of images.
Yeah.
You could try and figure that stuff out. So there's a lot of niche little areas, and I think there's a lot of room for expansion in terms of both research and in the strength and conditioning space that could go hand in hand in terms of developing not just resources for one particular sport of officials, but a range of officiating skills and drills that could potentially work across a few different sports.
Yeah. I couldn't agree with that more, actually.
AFL, soccer, rugby league, etc., etc. You can sort of go down that path and expand it further and further. What sort of testing were you guys doing in terms of fitness testing? Because we're doing traditionally we've been doing yo-yos and 1.2 kilometer runs, but because you guys are a longer distance sort of athletes, or you were managing, longer distance athletes, what were the considerations you guys were doing around there?
Yeah, great question again. So the 2 kilometer time trial, which is a real classic one that we tend to see. And I'm sure that they've probably started to introduce more now, because I think it's been 3 or 4 years since I've worked with them. And I know that they're really pushing for things to go full time as well, for not just the athletes, but I know my job went full time after I shifted on. But we also did dynamometer testing for adductors and hamstrings as well, which it was really good to see how people's strength was going in terms of improvement and monitoring them across breaks to make sure that they were getting enough training in when they weren't as supervised. But from a injury prevention perspective, and you probably know this too, it was really good to see if we had any discrepancies from week to week, if there's something that we needed to be aware of.
So were you doing handheld dynamometry, or were you doing sort of fixed position work?
Fixed position.
Okay, so what was that, vowed performance?
It wasn't a Veld, it was something else. But yeah, it was a long time ago. I haven't seen that brand again since I worked there.
Oh, okay. Right. And for those that don't know what we're talking about, it's essentially a scale that gives us a number of how many kilos they're pushing out against, as in an athlete will do a particular movement, and then it gives us a good number to measure, and it's repeatable, and hopefully it's fairly objective, minus effort, essentially. We try to get them to go to max effort every time, and we get a number of how hard they're or how much force they're able to produce in a particular movement. Correct me if I'm...
Yes, no, that's right.
because we'll just throw out these words and it's just like, okay, that's nice. Now how can I incorporate that into my training? So if you were trying to train up to become a AFL umpire, what would you recommend a young person to start to go out and do?
Yeah, I think for anything really, it's looking at the whole person. And we always say this, whether it's an athlete that I'm working with or a patient at the clinic, but we need to consider every aspect of life. And you don't just need to be, fit and running around, but thinking about what you can do in the gym, what you can do from a prehab perspective, making sure you're on top of your diet as best that you can. So just thinking about nourishing your body with what you're putting into it, and being really well aware of things like sleep and making sure you're getting enough hours, and that you're really controlling, well, not controlling, we don't want to be too harsh about things, but
Some
considering,
flexibility.
yeah, considering what your day looks like. We still want you to have a life. It's as much as we would call, especially at Essendon, the athletes 24-hour athletes. That is true, but it doesn't mean that we can't go out and have, you know, an enjoyable life. We can still think about social things and everything, but it's just being really self-conscious and self-aware of how we manage ourselves.
Mm. Okay, so I guess touching on that and what you're doing at Essendon with
Yeah.
developing that female program and whatnot, what were some of the things that you were establishing in that regards? Was it like athlete management programs or strength and conditioning programs, running programs, a combination of all of them, rehab? Like
So
it just
it
sounds like an all-encompassing role where you're just like deer in the headlights and thrown in the deep end, sink or swim. Good luck.
yeah,
Go
that
Ems.
you've just summarized it up pretty much there, Rob. So it was, yeah, an amazing experience, and I loved every second of it, but particularly that first year, being an inaugural team and not having existed before. I applied for this role and I'm like, this sounds wonderful. And it was, but it was so much work. And it was governing strength and conditioning. It was governing the on-field component as well. I was very lucky. I had a fantastic team of physios that I worked with. So they were very much looking at the rehab and prehab side of things as well. The coaches were fantastic, and we had a really great team in terms of doctors and dietitians. But it was like, it just took a little bit to get going and to find the right team and have everything in place. But the students from La Trobe were fantastic and saved me a lot of work when I could delegate some of the things to them. So shout out to that crew.
Good on them. Yeah, if you want to name them, by all means, go ahead.
Yeah.
No?
Sorry, not La Trobe, RMIT. Yeah, Nina Fuji was fantastic. So definitely. The clinic's connected here with La Trobe, and Essendon is RMIT. So I'm getting them back to front there, even their logos are the same colour.
That's not a problem. Don't even no, that's great. That's pretty cool in terms of that. But how much could you lean on the men's team to sort of draw on what they've already established to create what you were trying to put together?
Yeah, so my mentors through the AFL were absolutely fantastic. Justin Crowe was really, really amazing. And Cam, everyone would know Cam from Essendon. He was wonderful. And yeah, they really just took me on, and they said to me, you didn't probably have the most experience of everyone that applied, but you had the dedication, the drive, the interest, and the willingness to learn. They said they didn't feel like I was too set in my ways, that I wouldn't be able to, to work with everything that was already there. So that was great, but they also very much encouraged me to make it my own and to make it unique, because as much as there's amazing things that we can learn from the men's teams that already existed, the program was never going to be the same as the men's department.
No.
Yeah,
Yeah.
there were so many things to consider.
And in terms of injury management and prevention, again, going back to the current research, when is there going to be a building body of research for female athletes compared to just male athletes? Because when you look at the scale or volume of research behind male and female athletes, just male athletes completely outweigh female athlete papers, 10 to 1.
Yeah, definitely, which is really interesting.
You really only had a little bit to deal with, and a lot of it is because a lot of teams do keep their data in-house. They never actually publish any of their findings. It's all trade secrets, and I get it. You got a winning edge. You may as well try and keep it.
Yeah.
It does make it hard for young, aspiring health professionals like yourself and myself, really, trying to expand not just our skill set, but our knowledge in terms of depth and breadth. So
yeah, In saying that though, Rob, there were a lot of people when I reached out to, whether it be local or whether it be semi-professional or other existing teams, who were actually really happy to share. And I think that hopefully that's a sign to come of the breakdown of barriers. But I think particularly in women's sport, we actually want everyone to succeed. We want to see women do well. And that is more important to us than that intellectual property that some people talk about. And particularly, my experience at Essendon, like I said, it was great. And the mentors that I had, they really encouraged me to share, because they're like, if you create something wonderful, no one's ever going to know it as well as you anyway. So they were always passing things down to me and sharing with me what they'd done. And that was a huge lesson for me to learn in regards to culture and understanding that that's okay. To share, and that it's not about being better than anybody else. It's that knowledge is power, but you can't have that power taken away from you. You can just share it with people.
And there's plenty to go around. Don't think that
Yeah.
you're going to miss out by sharing it. I think
Exactly.
that's a really important message that doesn't get shared enough, not just in the sporting world, but in our entire industry and probably other industries as well. In that, if you're good and you know what you're doing and sort of you go down the path that you're going down, you're going to be okay. And you're probably going to be better if you do share the information that you know,
Yeah.
because there might be someone else out there that picks up what you've put out there and builds on it and makes it even better.
Yep. I couldn't agree any more with that.
Yeah, I do think there's sort of a bit of a long history, probably more so in sport than anywhere else, where they're trying to hide all those trade secrets. And hopefully, yeah, I agree. It's sort of a changing of the guards in terms of who's holding this information and how it gets disseminated. And
Yeah.
it'd be good to see it go far and wide. Yeah,
Definitely.
no, that's awesome. That's awesome. So, in terms of where you're working now, and for those, so we did, I don't know if we mentioned this, at the Active Health Clinic. So if people are trying to book in with EMS right now, how do we do it?
So you can give us a call. I've got, where's our number? On 98785394, or you can check out our website, and our website's got all the details on it as well. So if you Google Active Health Clinic, it'll come up. We've got a Facebook page. We've also got, if you are watching this and you've got an invisible illness like chronic fatigue or POTS or any pain syndromes, we have a Facebook page called the AHC Connection, which is just for people with these conditions so that they can have support and talk to people like them. And that's been super popular. I think we're approaching 1,000 people in there. And growing every day. And we pop little resources in there as well throughout the week too to help. So yeah, Google us, check out our Facebook, Instagram, all those things, you'll find us.
Now, it's important to note that, yes, you are based in Melbourne, but you're still treating people all over the world. Like your practice sort of acts internationally in terms of who you take on as patients and whatnot. So
Yeah.
You don't just necessarily have to be in Victoria and within your 25 kilometres to get the benefits that you guys are putting out there.
Yeah, that's right. So we offer telehealth everywhere. And a lot of that was inspired because, well, like I mentioned earlier, we treat people who might have challenges getting to the clinic. And then we started to discover that we are quite unique, and it's really hard for people to find these services.
Yep.
And interstate particularly, they're just, even specialists, it's hard to come by interstate. So a lot of our Melbourne specialists will treat telehealth as well. So we kind of followed on from that. And our director, Nathan Butler, he did a lot of work in the UK for a few years. And he's got connections where we realized, we can treat interstate. So we have people all over the place, UK, America, New Zealand, that we're working with via telehealth. And even at the moment, we've launched our COVID recovery initiative as well for people that have had COVID and they're suffering those debilitating effects of that post-viral fatigue and those challenging symptoms. So we created that program, and that's really been big overseas. As we know, it's been challenging in Australia for us, but there's been some really devastating impacts overseas too.
Yeah. And again, our heart goes out to all these people that are suffering at the moment. But that probably leads us into um, probably the main thing that I'd really like to talk to you about, and that is what you mentioned in terms of invisible diseases and or illnesses, and because really you guys are quite a specialist clinic, and you particularly are a specialist in this area, not just considering your experience as a practitioner, but also as a patient. For someone who's gone through these, you're positioned quite uniquely in the industry to help people better than anyone else, really.
Yeah.
So do you mind, I guess, unpacking what some of these conditions are on a very deep level, and sort of chronic fatigue syndrome in particularly, and sort of how you go about managing that, and those sorts of things?
Yeah. So I'll start with chronic fatigue syndrome. I think a lot of people would have heard the name, or they refer to it as ME, and dare I try and pronounce it, but myalgic encephalomyelitis
That was pretty good.
is.
I wasn't game enough to know.
Yeah, we always go for the short term. But yeah, so a lot of people would have heard chronic fatigue syndrome or CFS, and until I actually became unwell with it, I had no idea what it was or how it really impacted people's lives. And the short story around it, and this is why I'm going to start with CFS, is even the best of the best specialists still don't know exactly what's causing it or what's going on in the body. And with chronic fatigue syndrome, one of the big criteria to meet is that you've been unwell for 6 months with it, but also that you suffer from something called post-exertional malaise, or PEM, that we shorten it to. And that means that you are getting this sense of malaise, this fatigue, heavy sensation in your limbs, to kind of describe it a bit more, when you've done too much. And it's hard to say because everyone's really different, but exertion for some people might be, they've walked for half an hour and now they've had this malaise. But for other people, it could be that they're housebound and they've gotten up to go to the bathroom and now they've got this even worse malaise or fatigue than they had before. So I think a really big thing to note with any of the conditions that we treat here at the clinic is that they're spectrum based. So you might have minimal symptoms. It's always relative to the person, or you might have massive amount of symptoms where you are housebound or bedbound.
And another way to look at that would be in terms of function. You've got someone who would be high functioning versus low functioning.
Exactly right. And it changes between people, and it can also change across the health journey. So for me, I was housebound when I first became unwell, and now I'm working 5 days a week. And I do that, but I manage myself. Thank you, Rob. I'm very proud of myself to be able to do that, but it is something that I manage every day. And luckily, working at this clinic, everyone's so understanding, and my calendar with my patients is actually spaced out so that I can pace my day and I can have rest in between the patients that I see. So yeah, there's that. And then, like I mentioned before, POTS, the blood pressure disorder that we treat, another condition that I've got myself. And again, it's very, very debilitating. And we get a lot of symptoms with that in terms of dizziness, lightheadedness. Some people will have syncope or pre-syncope, so fainting or feelings like they're going to faint. We often find that these conditions, so chronic fatigue and POTS, can be comorbid with other conditions like IBS and depression and anxiety. Obviously, if we're dealing with these conditions, it's going to have its toll on mental health. And the other one as well is reproductive challenges, and that might be in forms of endometriosis or irregular periods, or more painful periods. So we tend to find that those systems are impacted, and like I said, comorbid.
Well, actually, the kind of is there, particularly with chronic fatigue, are there other conditions that would predispose you to getting chronic fatigue, or you might, if say you were a practitioner and you had someone walk through the door and they haven't been diagnosed with chronic fatigue syndrome, but they have, say, cancer or hypermobility. Are these they're obviously two examples that I've had some experience with, where I've had clients that actually have chronic fatigue syndrome, Lyme's disease. They've sort of gone through and then come out with chronic fatigue.
Yeah.
are there other conditions that you should go, well, if this person walks through the door, consider looking at their fatigue index
Mm.
and sort of go down the pathway of actually taking the time to investigate where they're at?
Yeah. I'm really glad that you asked that, Rob. And definitely any health condition that you see has the potential to have fatigue, whether it ends up being chronic fatigue in the long run, or whether it's coming from, treatment that's associated with it, or the actual disease or illness itself. It does need to be considered, because the more we can address that, and the sooner that we can address it, the less likely it is going to turn into ongoing fatigue if whatever treatment it is isn't ongoing. So the best way to kind of look at this is when we actually screen our patients here at the clinic and we do the initial assessment with them, we have a look at what's been going on in their life before they got sick, and particularly at the time that they got sick. And we find that there are a lot of predisposing factors in these people's lives, and genetics is one of them. So if you've got a family history of similar conditions, then it's more likely that you're going to have these conditions. Doesn't mean, and when I talk about predisposing, it doesn't mean just because you have these things that you're going to develop CFS or you're going to develop POTS. But we tend to see that if people have POTS and they have CFS, that these boxes are ticked as well. So genetics, blood pressure issues, dietary issues, psychosocial history of traumas and stress. And then we then look at the precipitating factors. So we tend to say, I'm not sure if trigger is a dramatic word for it, but there does seem to be something going on in these people's lives when they start to present with the conditions. And it could be that they had an infection or they've been diagnosed with something, and then it's from there that they develop it. And for some people, it can be emotional or stress-related traumas where something has happened quite significantly in their life, and then we start to see these conditions from there as well. So it varies a lot person to person, and yeah, it depends on what's been going on with them.
Yeah. And then with chronic fatigue, does it always have to be physical?
Yeah, that's a really good question again. It is physical and cognitive fatigue that you can suffer from. So we will see them together, but it's interesting when we talk to people about pacing and making sure they're breaking up their day, we really need to make sure that they're aware of the cognitive side of things, because they might be lying on the couch listening to podcasts like this and thinking that they're having good quality rest, but they're actually working their brain from a cognitive perspective, and that takes energy. And I think a great way for anyone who doesn't have these conditions to understand that is you think about working a 9-to-5 day and having absolutely no rest throughout that day, focusing on a computer screen. And you get to the end of the day and you do feel pretty sluggish and you do feel pretty gross. And I will highlight that there is a difference between feeling fatigued and feeling tired, but you can sort of tell from that, if you think about working nonstop and not having a break, you don't feel at your best afterwards.
No, most definitely. And would you say, from your experiences and I guess the practitioners that you work with, that potentially that there's been recently an increase in decisional fatigue more so than in previous times, specifically with more information at our fingertips in terms of the use of mobile phones and whatnot? Do you think that's playing a role at all?
I don't think I'd be able to answer that fully, Robert. It would be something that I'd have to go and look into a bit more. But I think in terms of the patients that we treat, there are a lot more factors that we need to consider when it comes to how they're managing their days. And technology is one of those, and social media, because people want to engage in that. And it's something that they enjoy doing. And we know that these platforms, they're designed to grab your interest and to keep you in. So you get that nice sort of sensation of you're enjoying what you're doing, checking your Facebook. But we also need to remember that by doing that and spending so much time on our phone, that it is taking a toll on us if we are already struggling from fatigue.
Yeah. Now, I'm going to put you on the spot here for a little bit. You mentioned activity pacing.
Yeah.
And I guess managing your time and energy across the day and potentially week.
Yeah.
Can you give us a good rendition of boom bust cycles and energy capacity,
Yeah.
and sort of take us through how that might work for someone
Yeah,
on a
sure.
very broad spectrum. Obviously, you need to apply it to everyone's individual case, but
Yeah.
the theory behind it.
Yeah, you hit the nail on the head there, that it is going to be really individualized, like everything. But it is having a look at your day. And this is where I said it's really interesting, because this is something that I would encourage for athletes, but something that I'd encourage for patients at the clinic as well. And it's about getting the most out of your days and the best out of you. But we want to make sure that our days are broken up, so that if we have periods of time where we're doing high energy activities like working, or exercising, that we're having breaks either side of that. So we go from high energy, low energy, or medium energy, and it's spaced out throughout the day so that it's not just go, 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 go. And it is really challenging, whether you're a patient here at the clinic or you're someone trying to apply this to your life to get the best out of it. Because with society, we're so encouraged to be go, 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 and that is glorified, to be able to do 50 million things at once. And something to be aware of for fatigue patients in particular. And even in saying that, I think it applies, like someone was telling me the other day in military settings that accumulative fatigue applies to them, because I was talking about it from a patient perspective. And then I was like, oh no, hang on, that's how a lot of athletes actually end up with soft tissue injuries, because they're overtraining. So to backtrack on that a little bit, is not only are we looking at fatigue and breaking our days up within days, we need to have a look at this in the long run too. And it might be looking at our whole week and being like, have we paced our whole week well? Have we paced our month well? And for those listening who might be into strength and conditioning, that's where we start to look at planning our athletes' months and having those taper cycles in there as well, to make sure that we're not accumulating fatigue. And it's, yeah, I jump around a lot because it's so intertwined between patients and athletes. And I think that's why I really enjoyed what I did working in football as well, because we do the same things with the athletes as we do with the patients, but the capacity levels are just different. So yeah, it's really, really interesting. And some of the research now that's coming out in the Defence Force about making sure people are actually rested so that they can make the best decisions when they're out there on the front line is really, really fascinating.
Now, two, I guess, groups that I know listen to this quite particularly is uni students or people going into uni, particularly looking at getting into a health profession, and the other one's referees. Decisional fatigue is huge for us. As a referee at the moment, as soon as you get into sort of just past park footy, it becomes high-end training, and you're training all year round. You get Christmas off and maybe a couple other weeks throughout the year, but really few and far between. Put that aside for a second, but take a student perspective. When we apply activity pacing and I guess activity management to a student point of view, would you say it'd be smart to schedule your activity across the semester rather than pushing everything into the last week of the semester when it's all due at the back end?
Yes.
What sort of advice could you give those guys that potentially don't have chronic fatigue syndrome but could be putting themselves at risk of actually going through some fatigue symptoms, perhaps?
Yeah, I love that you asked that, Rob, because I saw that so much with the cohorts that I've studied with. And I think the biggest thing to understand is that we need to work smarter, not harder. And if we space out our study across the semester and we do little bits here and there rather than cramming it all in at the end, we're going to get better quality study out of that. So we may not have put in as many hours and it might have been spaced over a longer period of time, but we're more likely to remember what we've learned and be able to recall it when we need to in those high pressure situations. Because something that's really important, whether it comes to umpiring, refereeing or studying, is that when we are under pressure, whether it's out on the field or in the exam room, that frontal lobe in our brain, it starts to shut down with the release of adrenaline, and it makes it really hard for us to concentrate and to remember things. So the more we can spend across a larger period of time getting quality information into our brain and retaining that, the more it's going to pay off for us in the long run, whether that be exams or in the field.
Yeah, I couldn't agree more. Is there anything else that you wanted to touch on in terms of invisible illnesses and sort of, I guess, something that, maybe we haven't already discussed at length or whatnot?
Yeah, I think it just reiterating, if I haven't already said to people, that it's just important to get out there and get the best care for yourself. And, if that means getting a second opinion for your health, or, talking to other specialists, you only have one body and you only have one life. So make sure you really follow that up as much as you can. And even if you've had bad experiences with people in the past, there are others out there that are going to be able to help you or might be a better fit for you with your health. So keep that in mind. And even if you have a condition and it's not one of the conditions we treat here at the clinic, I'd be more than happy for people to get in touch so that I can help point them in the right direction too.
And
That's
if they're going to do
something.
that, if they were a student, should they go through Instagram or should they go through LinkedIn?
Yeah, so LinkedIn is probably the best way to get hold of me, and also the Active Health Clinic website. You should be able to find some contact details for me there as well. But yeah, something that I'm super passionate about, having spent a lot of time in the healthcare system myself, getting some help. And from a student perspective too, I'm really happy to help people with their direction or advice or anything that they want. I know I've got a lot of people who, like, I've never met, but we've connected on LinkedIn and we've had a good chat and just help them out, because I did 9 years of tertiary studies and it was a really, really long process and I don't regret any of it. But to have some of the insights that I have now would have been helpful earlier on. And so I'm more than happy to share that with people as well.
Yeah, and I think that kind of goes back to what we were saying much earlier, where especially younger people in the industry right now are very, very happy to help young guys coming through, or young guys and girls
Yeah.
coming through. So if you do have questions, don't be afraid to reach out. It's not an inconvenience. We'll get back to you. It might not be today, it might not be tomorrow, but we will eventually get back to you. Our patients come first, obviously.
Yeah.
Probably our family and friends. We sometimes put them second, which we shouldn't always. But thankfully they understand where we're at and love us dearly. But yes, please reach out to us, because we're more than happy to answer any of your questions, and hopefully that would put you in a better position to work with them in the future, and vice versa.
Yeah.
So there's plenty of love going around in our industry, so don't be afraid to reach out and get some. Now, you mentioned in terms of you getting some treatment and whatnot, what strategies are you taking to sort of take care of yourself at the moment? If you're
Yeah.
share, you don't have to, but if you're happy to share.
No, I'm more than happy. So 100% I practice what we preach here at the clinic. And, I don't just do that to be a good example, but I do that because I know that my whole life needs that balance. And if I don't implement those things, then I can't do the things that are really important to me. And I need to put myself first and be in the best position that I can be with my health so that I can help other people. And I think that's something that I pretty much live by, because I just think that that's what I was made for, was to help people in the health industry. And yeah, I need to look after myself first.
Is there a time where you didn't look after yourself and you regretted it after?
Yeah, I think so. Early on in my journey, before I understood what I needed to do with my health, I definitely wasn't looking after myself, but I think that was a lack of education and not knowing what was going on. But I've been relatively good, potentially when I was studying my master's degree. So I studied master's, had 2 jobs and had placement.
You're preaching.
Yeah. I think a lot of people could relate to this. So I was a lot further down my health journey. So I was managing myself a lot better, but it just meant that I didn't have probably the time that I should have for the extra things like being social or, having good relationships in my life outside of work and outside of uni. So I wouldn't say I'd do anything differently, but it's something I think being aware of in the future and understanding what my priorities are.
Yeah, that's massive. I think that's something that I'm actually learning at the moment is putting myself first rather than putting everyone else first.
Yeah.
It's a difficult sort of balance for us to do, because I guess we get into this industry because we've got such a helping complex and we just want to help everyone, and we can't help ourselves but help everyone, and it's hard to say no sometimes, but that's something that just comes with time.
Definitely. It wasn't something that clicked overnight, that's for sure.
Yeah. And it takes practice as well. Like,
Yeah.
you might be able to say no the first time, and then the next time you're like, yeah, sure, no worries. And it's like, I probably shouldn't have done that. And the next thing you know, you're helping someone for a whole year, and it's like, what about me? So no, good stuff. How important is having a furry friend to get you along the way?
Oh, yes. She has been a phenomenal part of my whole life, full stop. But the impact that just my border collie Kai, my doggo, the influence that she's had on my rehab, because it's been the last 6 to 7 years, has been phenomenal. When I was housebound, she was just there to give me snuggles in bed, which was amazing. And then as I started to gradually reintroduce things back to my life, she was there to take me out for those walks that went for like 60 seconds down the road and back. So that's all I could imagine, or all I could manage, sorry. And now, she's there for me to support me in my walks. She's there to support me in my treks to the Dandenongs. So she's an amazing dog. And without her support, I honestly don't think that I would be where I am now, because she's been just wonderful. And from a mental health perspective, it's been amazing.
Yeah,
so,
it's like you've got your own little buddy there, just helping you along the way.
Yeah,
it's good.
Exactly.
Oh, that's awesome. Was there anything that you wanted to talk about in terms of like the industry, where it's going at the moment? Because I've got one more thing to ask you after this before we get onto that.
I don't think there's anything else. I'm just excited to see where things go with telehealth, and I'm really hoping that we can still get those Medicare rebates moving forward. Yeah. I don't see why not. Maybe controversial for some people, but I just think, why not? It's giving people, a quality of life to be able to see us. And I know it would be the same with any other ex-phys practice. And the benefits are just too hard to ignore. Like, if we can get these people the help that they need and take some of that stress off the healthcare system, why wouldn't we do it?
Yeah, I 100% agree. If they don't make this now the new normal in terms of Medicare rebates and whatnot for EP and physiotherapy, telehealth, and even GP consultations, something is gone astray in the government. But we'll see if this message gets out to them. Hopefully it does. But yeah, okay. So I guess my last question, and you had no idea that this was coming in and whatnot, was where to now for EMS? Like, what is, I guess, your plan, if there is any, going forward from here? Like, we're happy practicing, obviously, where you are and whatnot. But if you could sort of allude to, potential, this would be nice. Is research on play in terms of, or have you done your 9 years? You're not going back to get that PhD. I mean, you've done enough to almost get it, but so I guess what's on the books for you?
Yeah, so obviously practicing at the moment is really, really rewarding, and I'm loving that. But being like one of these type A personalities that we so often see at the clinic, I'm always kind of looking for more. And it's not because I don't enjoy what I'm doing, but it's because I just feel like I have so much to give, and I want to keep challenging myself and growing as a person. So definitely, like, I'll continue to practice, because this is my dream job that I'm in at the moment. But research is something that I'm really interested in and really passionate about. And that's where La Trobe does come into play with the clinic. So we do have a lot of the master's students who'll bring their research projects to us. And in saying that, so we will help to guide them in the right direction of research for the clinic. So I'm hoping to step up into that role when things settle down with COVID.
You starting to get your name on some papers?
Hopefully, we'll see.
Soon.
But yeah, I'm more interested in, being able to help people with these conditions. And I think this is going to be a step in the right direction. But, it would be a bit of a bonus. Everyone at the clinic is, they've nicknamed me the Peacock. So I've got a bit of that flair for jumping in and networking and or getting involved with those sorts of things to get my name out there. So that would fit to my personality.
I hope you're taking that as a compliment, not as an insult.
No. It's very much a compliment.
There's this tall poppy syndrome rubbish that goes on in Australia. Don't listen to that garbage.
I don't know about that one, but no, I really enjoy the peacock side of things because they talk about the peacock being individual and just being themselves and being really authentic. And they say that, so there's some good feels to it. Coming back from setbacks as well, because they say that peacocks can shed their feathers and move forward with their life. And I kind of like to think that I've grown my feathers back after my health journey and I'll keep growing them and flourishing from there. So it's nice. Two sides to it.
Oh, that's lovely.
But yeah, I think after COVID settles, potentially having a look at what I could do in the sport industry as well, because I did really enjoy my time there.
Dabble between the two?
Yeah, because there's so much overlap as well. We see patients here at the clinic who have a sporting background or they want to get back into sport. So whether that be back into football or, I've had a chat to some people about working in the disability sector as well. I don't know what it looks like yet, but definitely open in that regards. So
are you working with athletes with chronic fatigue as well?
Occasionally we do have them referred here to the clinic, and sometimes, they're not interested in getting back into it, and sometimes they are. So it just depends.
Managing everyone else's sort of individual needs.
Yeah.
Now, are you shooting threes still?
I'm not, unfortunately. Okay. So with my management of my health conditions, I am still limited with what I can do physically, but I'm making progress and I'm really happy. Like I can walk for an hour and it might not sound like much to some people, but from where I come from, it's huge.
Being bedbound to where you are now, that's,
yeah, it's massive.
Every step along the way, you need to celebrate that as well.
Yeah. And we're so big on that here at the clinic, celebrating our wins and what we're grateful for. So there's not a day that goes by where I don't think of how lucky I am.
Yeah. Well, Ems, you've been honestly amazing. I didn't really know what to expect, and you've sort of blown expectations out the window. So
thanks, Rob.
No, thank you. Like, honestly, you guys down in Melbourne get trained at a very high level, and in awe of, I guess, what you guys are managing to accomplish down there, and moving the needle towards some pretty positive things, not just for yourselves, but for the entire industry. So I appreciate that. Keep up the good fight, and keep carrying on. So again, one more time, if people want to find you, it is...
Active Health Clinic. So you can find me through the website there. You can find me, Emily Bland, on LinkedIn. And the other one I didn't mention is that I have got a blog as well that is all things chronic fatigue and orthostatic intolerance or POTS. And that is xphysm or xphysm.wordpress.com. But again, you can find that through my LinkedIn too. So I don't think you'll have any issues finding me. There's so much stuff out there now with technology. It makes it a lot easier for us.
Yeah, definitely. No, that's awesome. So xphysm, guys, look it up, Google it. It's not hard. People that don't know how to spell xphys, xphys. xphysmem. So you guys got this. Again, thank you so much. You've been wonderful, and hopefully you guys are on sort of, you can see the light at the end of the tunnel now, and lockdown is something that you guys don't have to speak about for a while, hopefully.
Yeah, fingers crossed.
Okay, good luck, and again, thank you very much.
No, thanks very much for having me, Rob. I really appreciate it.
It was a pleasure. Bye.